Today on Aging Untold, we're talking about sex, and so is your granny.
He sat me down and he asked me to find him someone he could have sex with.
We'll tell you what changes in the bedroom as we age, and some of the challenges seniors face in intimate moments. Plus,
you're in a hospital and the nurse comes in and says, okay, we're going to discharge you to a sniff. Well, what's a sniff?
we're cracking the code on medical lingo, the acronyms you need to understand for getting the most out of your healthcare. Also ahead, high school sweethearts show us how the most profound connections are spelled out in the simplest ways. Experts with advice and solutions. You're watching Aging Untold with Aging Well Coach Catherine Ambrose, gerontologist Sam Craddock, aging expert Amy O'Rourke, and board-certified physician Dr. Ray Rogers. We're all getting older. It's about time we talked about it.
Welcome to Aging Untold. Sex in our 60s and 70s may look different than in our 20s and 30s, but good sex can happen at any age, and the benefits are worth it. We're talking about increased happiness, improved physical and mental health, and a longer lifespan, just to name a few. There are some challenges and concerns. Dr. Ray, let's talk more about the benefits first, then we'll discuss what changes with sex as we get older.
Well, there are many health benefits with sex in terms of, especially on the heart, because you have increased circulation, cardiovascular, decrease in blood pressure. These are all beneficial. You also have a release of a lot of the feel-good hormones, that dopamine that makes you feel good. You have some of the other neurotransmitters. Oxytocin makes you bond more and all that. And even some of the other ones that decrease pain, endorphins and all that. So it's just an overall feel good. So I always say, think of sex as medicine without a prescription.
You know, you hear a lot, especially let's say women that lose interest in sex. Could that be hormonal imbalance? Could there be a medical thing going on?
Usually there's a lot of medical things going on. So it could be physical, you know, the loss of hormones declining and all that, as well as it could be an early clue to even some medical conditions like some heart disease. You don't have circulation, so you're not really, your thought clarity and all that is off, or anxiety, depression, but it can also be emotional. You know, what are your feelings towards your partner?
Oh, yeah.
Well, and I think, okay, sex and money. Nobody wants to talk about it. The stigma around sex is massive. It's around older people. It's huge.
Oh, because they're not doing it.
Well, you don't know that they're not doing it.
I know they are doing it, but
they are doing. The kids are aghast that they're even
like,
thinking about it. So I had a guy in a community, and he sat me down and he asked me to find him someone he could have sex with. Now I said, you want me to find someone you can pay for sex? And he said, yes. So I know it was awkward and I felt bad, but the bigger issue is, what do people do?
He just wanted to feel good.
Yes. He wanted companionship. He wanted that honestly, that
bonding.
physical and sexual release,
but
also that bonding. And let's not forget, STDs are more rampant in our senior communities than they are anywhere else. The highest numbers are. So while we might think grandma and grandpa, mom and dad aren't doing it, they are. And they may not be doing it necessarily with one partner, because what I've seen, and I have seen this, my eyes, are one guy, one man servicing many females, and that's how it spreads so quickly.
Right.
So we have to talk about this, especially when it comes to our age community, to prevent the issues, the STDs, the UTIs, sexually transmitted diseases, and urinary tract infections. We have to, because they're causing great health.
So just like you can have good benefits from health, you can have the negative if it's not, you know, in a responsible way.
Negative consequences.
Yeah. If it's, you know, if you don't protect in the correct way.
Yeah.
But it is part of healthy aging and also just being a human. It's part of the human experience.
Yeah, no need to be embarrassed about it. I mean, I think this generation feels embarrassed to talk about it, but it's a real. You don't think they are?
The older generation is
the older generation. When I put,
embarrassed.
Yes, exactly.
And the younger generation is embarrassed to talk about it regarding the older generation.
Regarding the older generation, because they can't envision that older people would even consider
You know,
Getting naked and
everybody
playing.
needs a Dr. Ruth, right?
Right.
Oh,
You need
isn't
to
she
go.
amazing?
I know, amazing. So
Yeah.
I encourage people to go to therapy, get a handle on your libido, and then talk about and get practical advice about where you can find your outlet for that natural human behavior.
Even if it's a one-person party.
That's right.
Yeah.
Just making sure that you're safe and that you're protecting yourself and the hygiene is there, because the lack of hygiene and the lack of cleanliness afterwards is creating all these urinary tract infections and other issues that then lead to
That's right.
dementia type symptoms and other things that we see negatively. If we can just talk about it openly and get everybody on the same page, then it's like talking to a teenager about wearing a condom or having protection, talking to our aged community about doing things with hygiene and protection is equally as important.
And they think protection is for not getting pregnant.
Right. You're not going to get pregnant. You're 80 years old. You're not getting pregnant.
You're not getting pregnant. But
Right.
but the STDs,
That's
Dr.
really
Ray,
real. And the other part to that is orgasms is kind of like a neural hormonal reset.
Sure.
So that makes the brain and the hormones are interacting together in that.
Makes them sharper.
So
Absolutely.
again, for healthy aging,
Healthy
it is
aging.
important, and so
It is
it's worth
important.
being curious and investigating.
Then I've also had some of the men that have come to me and they're like, it's like shooting pool with a rope. Can you help? So, I mean, at that point, at least I've opened that door of giving them an outlet to come and talk, because they're not going just to their physicians and saying,
It's still
things aren't
considered.
working.
It's considered a taboo. Men are just like.
Oh yeah,
When the real fact is, when you start to have any kind of erectile issues, that is an early marker for heart disease and other diseases. And that is a silent, like, hey.
That's probably the most important point I want to make, is that men that are in your 30s, 40s, 50s, if you're having a problem, if your man is having a problem, know that it is not just ED that's the problem. There's something else going on. It needs to be addressed, and it can be the heart.
Right.
And one of the earliest signs that show up in even young men is loss of spontaneous erections. That is a change.
Oh,
That's a change.
The morning.
The morning hoo-ha.
Okay.
Yeah, that loss is, and it can happen as early as the 30s, but it's telling you there's some changes already going on in your vasculature, in your system.
So there's
and all
blockages going on that's not allowing that blood flow.
Correct.
So really, if you're having issues with your libido at any level for any reason, medical clearance would be the first step.
Or at least evaluation, you have to talk about it, or at least mention it.
So we all agree, thumbs up on sex.
Thumbs up.
Absolutely.
All right, we'll be back with more.
Coming up, when a disease attacks your ability, but not your will to live.
You decide to get back to living life.
We'll share a man's story of how he's beating the odds and coaching other gymnasts. But first,
And then you go into the nursing home or the rehab center, they've got a whole nother list they want you to adjust to. ADLs. I mean, what the heck? ADLs.
understanding the ABCs of healthcare can make a big difference when you're a caregiver. We'll simplify the jargon so you can help with confidence.
heard the old saying, words have meaning, and so do acronyms. For example, there's PPO, HMO, and ADL. These letters can play a major role in healthcare decisions, but they only help if you know what they are. So ladies, let's take a closer look at some of those medical and caregiving acronyms.
OMG.
Right?
LOL. I mean, stop it already. Every industry,
Right.
every industry has these acronyms, but our industry, we impact lives.
Yes.
These acronyms aren't just like throwaway acronyms. You're talking to a healthcare professional in a hospital and they throw out DNR, past discharge, vitals, all, and the families just, they don't, one, they're trying to adjust that their family members in a hospital, but then to adjust to the acronyms that industry, and then you go into the nursing home or the rehab center, they've got a whole nother list they want you to adjust to. ADLs, I mean, what the heck, ADLs?
ADLs, it's all activities of daily living. For a caregiver, I say it's all day long, it's something. And that's exactly what it is. But we use them because everybody talks in their own language. Every industry, everybody, a plumber talks in theirs. You know, everybody uses their own terminologies.
ADL is a really important one that I tell seniors, like, you need to know what this is because you are going to be judged by your ADLs as you age.
Sam, tell them what an ADL is.
It's
what
activities of daily living.
Break it down.
Break it down. So it's what we're able to do ourselves and how independent we remain.
Bathing, dressing, eating, going to the bathroom.
Those, yeah. All of the things that we take for granted as able-bodied adults, and then as our aging community, starts to lessen or become more limited, then we qualify their need based on their ability to do their own ADLs. And so, but we use in acronyms, we use SNF. So you're in a hospital and the nurse comes in and says, okay, we're going to discharge you to a SNF. Well, what's a SNF? Am I sniffling? What is
does
this?
that mean?
It's a skilled nursing facility, and we as care providers and in this field, we often take for granted that what we're saying. I can't tell you how many times I've taught and I've been teaching on UTIs because we know that's my favorite subject. And I have people go, what's a UTI? Oh my gosh, it's a urinary tract infection. So I guess what I'd tell anybody is if you don't know, ask.
The other thing too, a nice solution I try myself when I'm talking to patients and all that is I don't use the acronym. I'll say adult daily living, also known as ADL. You can educate the patient so they know what they're hearing. So you may hear when you're in the hospital, we're going to evaluate you. When you're getting ready to go home, they may come in and say it's going to be a skilled nursing facility. You may hear it as SNF, and if you don't remember what I told you, just make sure that you ask.
Yeah, and that's the only time I like to use the F word, skilled nursing facility, because if it's anything else, I really try to avoid the word facility and say community. So if you use that with your loved ones, if you use that in your conversation, it's much more empowering. No one wants to live in a facility. A facility is warehouse or prison. So empowering language is important, and ask when you don't know.
Well, and what I like is the minute the crisis hits and you're in the middle of the healthcare system, whatever system that is to stop and say, please give me the acronyms that are in this facility. Tell me now so they can take notes.
We have so much more, and we'll be right back on Aging Untold.
Coming up later, they've been playing the same game for 6 decades.
I like to play defense, so I will play to block him more than make points.
How one couple discovered their secret to lasting romance isn't winning, it's never stopping the match. And after the break,
I wish I had cancer instead. That's how crazy a diagnosis it is.
one coach faces his toughest opponent yet. How he's using support from his team to battle a deadly disease while still inspiring young athletes.
Many gymnasts spend a lifetime perfecting their routines. But for a former gymnast turned coach, a life-changing diagnosis forced him to improvise. Rob Cervic has ALS, a nervous system disease that causes loss of muscle control and gets worse with time. Although he's confined to a wheelchair, he still found a way to dedicate his life to coaching with some help from his gymnastics community. Nick King is in Phoenix with a story that will inspire us all.
There's no amount of training or strength or padding to soften certain blows life has in store.
It's the worst news you could ever hear. I wish I had cancer instead. That's how crazy a diagnosis it is.
Ready?
You really mourn your own death, kind of, at the beginning of it.
But with the right people around, encouraging,
You decide to get back to living life.
most of Rob Cervic's life
A little sip.
has been spent here.
Thank you, sir, at progesterone.
He just says, I got to get in. Every day, I got to get in. I'm going to be there.
At Aspire Kids Sports Center in Chandler, Cervic is a gymnastics coach.
Everybody in the gym is impacted by him, every single person.
His body is battling a losing fight against ALS. Cervic no longer has control over his arms or legs. Now, a shell of himself physically, Cervic needs a lot of help. The only thing he's focused on, though, is continuing to help others.
I think it shows who he is at the core, how much he cares. How much he wants to have an impact in other people's lives. Sorry. It's tough. It's inspirational, though. It really is.
I still have a lot to give. I can't spot them and go to meets with them, but I still have knowledge. And as long as I can give that, I'll be happy.
Wow, how fitting that the name of the gym is Aspire.
I was thinking the same thing.
What a legacy. Now he's impacting people all across the country, seeing that story and to have that spirit. And I was just thinking, I'm so grateful that he has his mind and his spirit and that he is continuing to live.
It's a disease that attacks the motor neuron, the muscles and all that. And so you look at it, you can take the muscles, you can take the physical, but you can't take his heart.
You can't take that spirit.
Can't take that heart.
And what I loved the most was everybody in that gym saw him for what he could do, not what he couldn't do.
You know, I was watching him and listening to him. I couldn't talk for a minute. I was about to lose it.
Yeah.
Just lose it. It was so moving.
It is.
But they're really connected to him and him to them, and he is there with them with his whole soul, which is really what we all have.
Yeah.
He shows up every day. He shows up every day.
It's interesting how on our human journey, the impact that we can have even when we have really serious things going on. We don't know what kind of legacy we're leaving to the last minute.
That's right.
And hopefully Rob knows. I suspect he does.
That's why I say we live every day.
Yeah.
You know, we live every day until that final sunset.
Mm-hmm.
It's when we begin to die that it changes everything.
Yeah, because
So,
he still has purpose.
he's
still
still
looking at
and passion.
preparing him for meets. He's still future focused.
Uh-huh.
Yeah.
And the others are still looking up to him.
Yeah,
Right. Yeah. They're like, I want to be like him.
yeah, yeah. Wouldn't it be a wonderful world?
It is a wonderful world, and Rob just showed us. So great story. And we'll be back with more on Aging Untold.
Coming up next, how do you spell love? For one couple, it's G-A-M-E. How a little competition has kept them spellbound for 60 years.
Celebrating 60 years of marriage is no small feat, and a couple in West Alabama says they're taking it one letter at a time. Every week they sit down to play a beloved board game they got as a wedding present. Judd Davis shows us how their matchups help keep the magic alive.
Kitty and John Lampkin are high school sweethearts. They just celebrated 60 years of marriage.
It's a lot of give and take. She does most of the giving, I do most of the taking.
As newlyweds, they got something that changed their life, letter by letter, and they still have it.
This is the original Scrabble game and the original board.
So, 4 or 5 times a week for the last 60 years, they face off, making words and scoring points.
And it's just been a lot of fun, something we do together, and we've been doing all our lives, and here we are in old age and we're still doing it. So
it's challenging, and it's easy to set up, it's easy to put up.
Kitty is a former teacher, John a former coach, and they like to compete.
I get 9 points.
Nobody's gonna stab or cut each other, but it's serious business. She will stay on the borderline edge of cheating.
Just go ahead and say it. He says I cheat, but I really don't.
Anytime you pick up a dictionary and look up a word and then play it or to back it up, I consider that cheating.
They each have their own style of play.
I like to play it from the standpoint of seeing how many times I can play all 7 tiles on one play.
I like to play defense. So I will play to block him more than make points.
She wants to keep it closed in, and then she wants, bingo, then she'll hit you. So I know what to look for now.
He should. They've been doing this since 1965. Winning never gets old.
That is a hoot and a half. All right, you won.
So John has bragging rights on this day. It'll likely be Kitty tomorrow. You could say their marriage is a triple word score of love and fun.
A hoot and a half.
A hoot and a half.
I'm so working that into my everyday vernacular.
I loved how dressed up they were, how put together, how like.
Honey, did you look around the house? The game's not the only thing they have from when they got married. And I love that. I love the old stuff that you could just see around.
But look at that engagement.
Mm-hmm.
The engagement and the ability to focus and mentally to put things together.
Oh yeah.
That is.
The genuine competitiveness.
Yeah, and that's a form of exercise. That's a great exercise.
Fun and teasing. Yeah. So we can see why that marriage lasted.
I love that she was a teacher and he was a coach, but she's the most competitive of the two.
Absolutely.
And they don't take themselves too seriously. And I bet how they are in that game helps them when they run into trouble.
Oh, absolutely.
It just bonds them because they compete, they're real, and then they might have an argument. And that's such a great little interacting with the world.
Yeah.
Yeah.
How cute.
What a great story.
I just loved it.
Kitty and John, that was awesome.
That was amazing.
We don't talk enough about aging, and that's why we're here, to embrace it and talk about it together. Until next time, this is Aging Untold.
On the next Aging Untold, it's okay to be gray. Getting older isn't something to hide, it's something to honor.
You know, we keep chasing this youth thing when instead of embracing the fact that we're doing what's normal.
We'll show you why embracing the journey can make all the difference.